Today I want to share with you a technique to remove an implant. Traditionally, osseointegrated implants are removed using a trephine, but the amount of bone that comes out with an implant can be significant. What I want to do is to remove as little adjacent bone as possible, and in some cases I can even place the implant, another implant immediately. When removing an implant from the mandible, especially an implant that's been integrated for a while, your only option may be to use a trephine. But when removing an implant from the maxilla, most of the times you just need to back out the implant using the correct driver. But sometimes there's a broken screw or the internal connection is stripped, and you can't get a driver or a removal tool to engage. That's when this technique may come in handy. If I have some room to remove bone, I'll start out by using a quarter-round surgical burr to remove some bone, either all the way around the implant or just the mesial and distal portion of the implant to preserve the buccolingual bone. I actually use this technique to extract difficult teeth instead of using periotomes. And then after that, I'll try to luxate the implant with an elevator. Then I'll try to reverse out the implant using a forceps. But you can't turn the implant because the implant body is circular and the forceps will just slide around the circumference of the implant body. So I need to create a parallel flat spots for the forceps to grab onto. Here I'm going to try to create two opposite flat spots on the implant, and I typically use a 557 surgical burr to do that. You could certainly use a diamond burr, but I find that diamonds typically create a lot more sparking. And what I'm trying to do is when I create the flat spots, your initial thought is to create them perfectly buccal and perfectly lingual, but I actually skew them a little bit, and I'll show you in a second why I do that. Now that you have created two flat surfaces, you can grab those flat surfaces with the forceps and you can turn counterclockwise. And you should be able to actually turn the implant at this point. Now, once you get to a point where you can no longer engage those flat surfaces, you can actually create more flat surfaces. But if the implant is loose enough, like it is in this case, you can just grab the implant and just turn it a little bit more. If I make my flat spots perfectly buccolingual, as soon as I start turning, I'm going to start running into adjacent teeth, and I may only get about a 1/8 of a turn. But if I make my flat spots a little bit skewed, I can actually gain a little bit more of a turn. I hope this helps you in your clinical practice. Take care.